you look at breast implants, the last, I would say about 7 or 8 years, we've come a long way in terms of improving the technical aspect of the breast implant itself. I actually have a number of implants here for me, but there's basically two types of implants. There's either a round implant, and those come in two varieties. The round implants, as you can see, are round in shape. They have a certain dimension, and we choose based on the patient's anatomy in terms of what size and all that stuff. But in general, there's two types of round implants. There's a textured implant and there's a smooth implant. But these implants are round. They've been the workhorse of implant augmentation for many years. Today we have what's called a gummy bear or a shaped implant. The common term nowadays is gummy bear. But this implant is different than these implants because you can see that this implant is actually shaped to be more like the breast itself. Now, the question becomes, when do we use which implant for which patient? And that's my job, to help patients figure out which is the right implant type for them. You can see that this implant has more of a natural shape. This may not be right for every patient. Although it's a really nice new advent in terms of implant technology, this doesn't fit every patient. This may not be the right one for some patients, or it may be the best option for some patients, especially if you're really thin and you have a shape of your existing breast, that this would accentuate really, really well. These implants have become very popular, I would say, in the last 2 years, and we do quite a few of these. But still, the round implant still, in my opinion, is kind of the mainstay of the different types of implants that we use. Basically what happens is patients nowadays are empowered because of the internet. They can easily go online and look up every type of information that they want to, especially when it comes to different types of implants. My job is to be the referee. My job is to make sure that the information that they have is sound and correct. And occasionally patients will come in and they'll know exactly what they want. I want this size, I want this type, and I want it to be this way. And when that's correct, that's great. Sometimes it's not. My job is to make sure that I fit the implant into the right type of patient.